Got on my leather jacket Thriller. The show ain't nothing iller. Man, I'm a lady killer. If I want her, I'ma steal her. I promise I can make her fly away like caterpillars. So if you don't know by now, then you should probably get familiar.
Wait, you can catch me, Nat?
Oh, we will see about that.
Adha!
Ouch, my hand.
Nas, are you okay?
No, I think I scraped my hand. It hurts.
Oh no, it's bleeding. We need to go to the clinic now.
Hello girls. What seems to be the problem?
She fell while we were playing and is bleeding a little.
Alright, that's careful. It's just a surface wound, nothing too deep. But there is some dirt, so I'll need to clean it.
Will you eat first, doctor?
It will sting a bit, but I promise you it will be quick. I'm going to use iodine to clean your wound.
What's iodine? Why did just water?
Good question. Iodine is a powerful antiseptic that helps kill bacteria and prevent infections.
But why does it sting?
That's because iodine contains something called phenol. It's a chemical that helps break down harmful microorganisms. The sting is a sign it's working. Cleaning the wound can allow it to heal.
So, it's just like a superhero for wounds?
Exactly. It fights the bad guys so your body can recover faster.
Okay, I'm ready.
And all done. You're very quick.
Don't you think it would be quick?
Just keep it clean and avoid touching the wound too much. It should heal in a few days.
Okay, thank you, doctor.
You're welcome. Take care, both of you.
You were super brave in there.
It still stings a bit, but I guess that's the phenol fighting the germs.
See, you learned something new today.
Yeah, and next time, no running near rocks.
Agree, or at least wear gloves. Yum, that's so delicious. My stomach is so bad.
Adha, what did you eat yesterday?
I had the spicy fried chicken, but now I feel nauseous and my stomach is cramping.
That doesn't sound good. Maybe you ate something contaminated. You look really pale. You should go to the clinic.
Yeah, I think you are right.
Hello, what seems to be the problem?
I ate a spicy fried chicken yesterday, and after one day, I started having stomach pain and nausea.
Sounds like a possible case of foodborne infection, or even just worms. Have you had this kind of thing before?
Not really, just today.
Alright, I'll prescribe you an Anthelminthic.
Sorry, doctor. What's that? Until what?
Anthelminthic is a type of medicine used to get rid of worms or parasites from the intestines. Sometimes, food can be contaminated with worm ants, especially eat seafood that isn't cooked properly.
Oh, I didn't know that.
So it's like any normal medicine?
Exactly. Just take this once and it should help remove any parasites if that's the cause.
Thank you, doctor. I will be more careful with my food next time.
You're welcome. Rest well, drink lots of water, and avoid spicy food for now.
I never thought the guts still need deworming medicine.
Me neither. I thought only kids get worms.
Lesson learned and use to your food.
What is phenols? Phenols are important organic compounds with a wide range of applications in daily life. Owing to their unique chemical properties, they are widely used in the synthesis of essential products such as antibiotics, antiseptics, and analgesics. One common example, phenol, functions as both antiseptic and disinfectant. It is effective against a broad spectrum of microorganisms, including certain fungi and viruses, although it acts more slowly against moths. Phenol has traditionally been used to disinfect skin and to relieve itching, highlighting its significance in medical and personal care applications. Next, let's take a look at the types of phenols. First, we have chemical matrixectomy. Phenol is commonly used in surgeries for ingrown toenails. It is used on more severe ingrown toenails that don't respond to other treatments. The phenol, in the form of trichloroacetic acid, is used to stop the nail from growing back. Next is sore throat spray. Phenol is an active ingredient used in some sore throat sprays. A sore throat spray is a medication in spray form that can help numb your throat, relieve pain, irritation, or discomfort in the throat and mouth area. Lastly, we have phenol injection. Phenol can be injected into your muscles to treat a condition known as muscle spasticity. A phenol injection helps limit the signal sent from your nerves to your muscles that cause contractions. This allows you to move more easily and feel less discomfort. Next, let's take a look at the types of phenols.
I will explain the side effects of phenol, a toxic chemical used in labs and industry. Firstly, phenol is harmful to the skin. It can cause chemical burns and painful blisters. It can also be absorbed through the skin into the body, which may lead to serious health problems. Secondly, if phenol is inhaled, the vapors can irritate the nose, throat, and lungs. This may cause coughing, difficulty breathing, and in severe cases, fluid in the lungs. Thirdly, swallowing phenol is extremely dangerous. It can burn to mouth, throat, and stomach. It may also affect the heart, brain, and kidney, causing symptoms such as vomiting, seizures, or even coma. Lastly, long-term exposure to phenol can be very harmful. Repeated contact may damage the liver and kidneys, cause muscle weakness, skin discoloration, and even affect memory, sleep, and mood.
Next, let me explain about anthelminthics. These are medicine used to treat infection caused by parasitic worms, also called herrings. These worms often live in the human intestine and cause serious health problems like malnutrition or abdominal pain. Anthelminthic drugs work by either killing the worms or helping the body expel them, or without harming the person taking the medicine. That's what makes them special. They are not just important for human health, but also for animals, especially in veterinary and agricultural settings. Different antibiotics work in different ways. Some paralyze the worm, while others damage their internal system, making it impossible for them to survive. Now, let's look at some examples of anthelminthic drugs. First is ABDUL. It's a broad-spectrum drug, meaning it can fight many kinds of worms. Next, mebendazole. It's commonly used for pinworms, roundworms, and whipworms. Then we have ivermectin, known for treating strongyloidiasis and river blindness. It's also used in both human and animal. Finally, praziquantel is highly effective against tapeworms, and diseases like schistosomiasis. Most of these medicines are taken by mouth, and sometimes we need more than one dose to completely clear the
Let's dive into the main effects of anthelminthic drugs. Firstly is the paralysis of the worm. Many anthelminthics, such as pyrantel and levamisole, act on the neuromuscular system of worms, causing them paralysis. Paralyzed worms are unable to hold on to the intestinal wall and are expelled by normal peristalsis. Moving on is the inhibition of metabolism. Some drugs, such as albendazole and mebendazole, interfere with glucose uptake and energy production, leading to worm starvation and death. They inhibit enzymes involved in microtubule formation, essential for nutrient absorption and reproduction. Moving on is the disruption of cell membranes. Drugs like praziquantel disrupt the tegumen, which is the outer surface of certain worms, like flukes and tapeworms. This increases permeability to calcium ions, causing muscular contraction and parasite death. Now, next is immune system enhancement. Killing or weakening the worms makes them more visible to the host immune system, helping with natural clearance. And lastly, reduction of worm load. Anthelminthics reduce the number of adult worms, thereby minimizing symptoms like anemia, malnutrition, and gastrointestinal disturbances.
Now we go to clinical benefits. First, treating parasitic infections improve nutrition. Parasites steal nutrition, causing malnutrition, especially in children. Removing them helps the body grow stronger. Second, treatment relieves symptoms like diarrhea, pain, or bloating, improving daily comfort and quality of life. Third, early treatments prevents serious complications such as intestinal blockage or liver damage. Acting early protects long-term health.
In conclusion, anthelminthics are vital in treating and controlling parasitic worm infections. They work by paralyzing, starving, or damaging the worms, leading to their removal from the body. Their use improves health, nutrition, and reduces the spread of infection, especially in communities where helminth infections, which are worms, are common. That is all from us. Thank you.